Happy New Year to all of you. It has been a year since I met you all, is it? Hope you had a lovely New Year celebration, did you? I hope you did. Right, I'm sure. So welcome to another lovely year ahead with all of it. Welcome to Neethus Academy Reading. I am Vinod James. So nice to meet all of you. Are you all ready for today's session? Yes? Excellent. So nice to see all of you piling as usual. Good enough, good enough. Right. So what did you do on your New Year day? Did you all, had a great time? Yes? Did you all, what did you do? Tell me. How did you celebrate your New Year? How did you celebrate your New Year? Just give me a second here. Right, so I am Vinod James, as you all know. Okay, it has been 1 year before, I met you all. So tell me, how did you all celebrate your New Year? It's something which I am so eager to know. Alright, our students are piling up. 𝗁𝐺, good afternoon. Sarah Renee, good afternoon. Sarah, hi, Happy New Year to all Neethu family. Thank you very much, Sarah, for that lovely wish. So Happy New Year from all of us from Neethu's family. Right. So what are your New Year resolution? Our New Year resolution, as we have come up with a new insight, isn't it? How to crack your part A in 8 minutes of time. I hope you have seen, isn't it? Now you might feel that how can that be possible? So every time we are always indebted to each one of you because you are a patron. You always have been so much of a support to Neethu's family, and we couldn't resist in order to give you some insights on the aspect of how to complete your part A in 8 minutes. Simi Ajay, hi, I'm Simi from Qatar, wishing you a blessed year. Simi, wish you all the same. I'm sure that in this year you will fly to your dream destination in no time. Bettina, good afternoon, Happy New Year, Bettina. So again, a very, very, very Happy New Year to each one of you. Now, as I was just talking about, we have come up with a thing on the aspect of how to crack your part A in 8 minutes of time. Okay, so we're going to do that insight on the aspect once we go on the verge of part A, but still I thought we'll start with that and then we'll do the part B and then we'll go to part A. Anu Jobin, good afternoon, Happy New Year, Anu. So all of you, so nice to see after a year, isn't it? And even though it sounds sometimes, what is he talking about? It's an year now, 2023 and 2024. And I'm sure that all of you, this is your year to go and make to your dream destination. I'm sure that with all your practice and what we are going to give you, you will reach your dream destination in 2024. Shaji, Happy New Year, Shaji. Kalei, Happy New Year from Maldives. Good enough, nice to see. Justin Joseph, Happy New Year, Justin. So, Solis and Sarjan, Happy New Year to all my beloved students. So nice to see all those. I'm so happy to hear all those wishes from each one of you. Right, I hope all of you had a lovely party celebration, and now back to learning. Now, what is our first New Year gift to you? How can you enhance your party in 8 minutes of time? Alright, so what are the things that you have to really look? See, there is no doubt that, of course, your practice do take it to achieve it. Okay, there is no second thought about it. It's about how you practice. Now, how you practice is very, very, very important. Alright, in order to get into that 8 minutes of time. Okay, see, initially, don't try to overdo things. Okay, you have to take it slowly. So what are the things that you have to do in order to make sure that you reach that 8 minutes of time? Okay. First and the foremost thing, initially when you're practicing, don't keep on worrying or don't stick to your time. First, do make sure that your base is proper. Okay. The fundamental thing in order to achieve that 8-minute barrier, the fundamental thing is you have to have reading as a habit. Okay. Please understand, reading as a habit plays a pivotal role in order to achieve that 8 minutes of barrier. Alright? Now, why reading? See, our problem is we are not accustomed to read quickly. See, reading quickly doesn't mean that you have to read as fast as it. Yes, of course, it needs it, but not what you think is fast. Okay, as you read, you should be able to understand what you're reading. That's the most fundamental thing. And the other important thing is about keyword reference. And see, now what is the significance of Part A? As I've always mentioned, Part A is about, are you able to locate specific information which is required? Srimol, excellent, so happy to see you again. Sonia D'Souza, Happy New Year. Happy New Year, Sonia. Okay, now we are talking about how to tackle Part A in 8 minutes. So as I mentioned, reading habits is very, very, very important. Monica Vegas, good afternoon. So that is the prime thing in order to achieve 8 minutes of barrier. Okay. Now, how you're going to read? Monica Vegas, Happy New Year. Happy New Year. So how are you going to read? So the first and the foremost, Sonia D'Souza, Patsy also teaches daily. Sonia, as I mentioned, that is exclusive for our students, isn't it? You know it much better than why we are sticking on to. But of course, see, Neethu madam always have gift hampers for each one of you. Okay, so no sooner, maybe you'll have another gift coming your way in 2024. We have not yet. So, see, as of now, it's purely for our students. But let's see. Let's hope for the best. Yeah. Now let's see what. See, even though we have Part A and Part B, let's make it to the. Let's fine tune it. So bring it on the aspect of 8 minutes. Now, what is or how to do when you're reading? See, when you read, okay, see, we read on the aspect of without life. Okay, what do? We simply read as if we have to read. You're forcing yourself to read. No, that shouldn't be. See, I always tell my students, it's not what you do. It's about how you do it. Okay? So 8 minutes. One, I told you to start having a habit. Tomorrow when you're coming, okay, to the live, and also please do attend on a daily basis, okay? You have to ensure that you are a regular attendee on the aspect, because every day we will give you certain things. That's how it is, isn't it? We can't just pour everything on one shot and where we expect all of you to follow. It's not enough. See, learning is a process. Of course, you need some time to adjust onto it, and you have to practice it. Okay? So what is the first thing that I told you? I told you, please do start reading as a habit. Okay? Reading doesn't mean that you have to sit n number of hours. No. Small. Depending on your daily schedule, just allocate a minimum of 10 minutes. A minimum of 10 minutes out of your 24 hours. Clear? Are you able to do that? Ashley Jose, good afternoon. Lissamo, good afternoon, Happy New Year, Lissamo. Are you able to give that 10 minutes of your valuable time for reading? How many of you say that you can give that? Let me see how many of you can do that. Just put a thumbs up. Ullas Jose, good afternoon, sir. Happy New Year to you, sir. So nice to see all of you on the very 1st January 2024. So nice. So obliged to each one of you because you have taken that much amount of time to come wish us. So much obliged. Sonia D'Souza says, I can. Fair enough. So I want all of you to start saying, I will give my 10 minutes of time just to start reading as a habit. Lisa Mole says, yes. Fair enough. Bijisri says, yes. Excellent. Good enough. Bettina says, I can. Very good. Ashley Joe says, yes. Good enough. So Vera is saying, yes. Excellent. Monica says, I can. Very good. So I want you to take that as a New Year resolution today. Lisa Mole says, I will. Definitely, because there are lots of thumbs up coming in. Anu Jobin is saying, yes, I will. Munia Sami. Yes. Okay, fair enough. Vishnu Prakash, Happy New Year, Vishnu. So nice to see all of you. Wishing very much. It's all on, like I'll say, I'm on cloud 9 because a lot of my students have come wishing. Thank you very much. Kalaya, well, good enough. Shiny Sijo, good afternoon, Happy New Year. So the first and the foremost New Year resolution that you have taken is, I will start reading for 10 minutes of time. That is your first step to tackle to your 8 minutes. Understood? So what is the first step that you're going to do? See, as I mentioned, 8 minutes is definitely a short, but it is not that you will get it on the very first day. Okay? So be Happy New Year. I hope you had a lovely snow-filled New Year. Is it? Good enough. Soliraj and Sajana. Good enough. Kavita Vijayan. Happy New Year, Kavita. So, first and the foremost, see, as I've mentioned, you have to be a regular in here so that you would know what are the things that you have to do. So, what did I tell you to do? One, I told you to start reading don't think that you read anything on any other language, okay? You have to start reading English only. Please, it can be. Now, what are the things? Now, your next doubt is, what can I do? See, you can read anything that you aspire or anything that you love to read. If you love to read your children's English textbooks, please do. If you like to read storybooks, please do. If you like to read gossip magazines about film actors, do read in English. If you love to read news, do read. If you love to read disease conditions, please do read. Rajita Rajan, Happy New Year, Rajita. Monica, 10 minutes of reading every day. That is what your New Year resolution today. So do start this. I'll give you the next clue tomorrow. Fair enough? It's quite a good deal, isn't it? Now, first thing, you attend on a regular basis. Tomorrow, I'll be asking you how many of you have read, and you have to start validating what you read. Okay, so tomorrow I'll be telling you the next thing in order to enhance the 8 minutes. Because please understand, there's no shortcuts for success. Okay, as you know that there are n number of fraudulent people available in front of us, they always believe it's shortcut. Shortcut doesn't work. They always are for money. They always rip your money. Rennie Chauko, Happy New Year, Rennie. So first, that is the first thing that you have to do. One, attend on a daily basis. Two, you're going to start reading something. That should be your New Year resolution today. In order to, I'm telling you seriously, if you do this, I'll make sure that you start realizing how much of a potential person you all are. Clear? So that is the deal for today. Now we'll go into part B. Okay? So how are we going to do part B? We'll be sharing a material on the screen. Okay? So first and the foremost important, do stick to the time. There will be a timer. Okay, the clock will move. That is to give you that time pressure. Because you should know how it feels when you are time bound. Understood? So make sure that you're doing the material and don't come and say, I didn't find the answer. That's not right. Okay, we have to have the right focus, which is also applicable for your part 8 minutes. Okay, I'm just giving you certain clues what we will be talking about. Focus is another important thing. We generally we don't have that focus on. See, because another thing is about having a right ambience. You have to ensure that you engulf yourself with the right surrounding. Now, why is that important of surrounding? Students doesn't feel, see, they sit in front of all the people, they hear what they are talking, they hear what the news is talking, they hear what their serial are going. No, you should not do that. You should have a surrounding where, see, you have to provide yourself. Why? Because you are doing it for you and your family. You have to always remember that. Understand? So these are the 3 things that you're going to do for day 1. What is day 1? 1, you have to have habits. You have to ensure that you are having focus onto it. Understand? And most importantly, do attend. The next thing I'll be telling you tomorrow, what are the things that you have to do in order to bring your part A to 8 minutes of time. Because it is step by step. It doesn't come all together once. So the balance I'll be talking to you tomorrow. Now let's go to part B. The material will be shared on the screen. Do not waste your valuable time. Just do the material, find an answer. Once you have found the answer, don't type the answer. Just say done or put a thumbs up. Clear? So the material will be popping up on the screen and do bite the time. Let's see. Binila, blessing. Happy New Year. Thank you. Pleasure, Binila. It's always our pleasure to give you something. There you have the material. Please do the material and then we will discuss. All right. So the first time-bound period of this new year, isn't it? Still nobody have told me that you've done. I hope all of you have managed the time. Did you find an answer? Yes? Bettina, thank you so much. Pleasure is always ours, Bettina, because Neethus family is always obliged to each one of you. Ashraf, Happy New Year. Happy New Year, sir. Kalei done. Okay, fair enough. All of you have done? Do you all get an answer? Out of the 3, A, B, C, which one? I hope you all did manage the time. Did you? Sarah Rani done. Okay, good enough. Bettina done. Good. Kavita Vijayan done. So I would always ask, or I would always request all of you. Monica done. Good enough. See, please do like the page. Please do subscribe the channel. Please do follow the page. And also, please do share the link on your social media platform. Now, why? Because as I mentioned, There are n number of students who are still unaware of how to do Part A, what are the things that you have to do in Part A. So if you can do that, it will be a great help to those students. Okay, because our job as trainers, as Neethus family, we always believe that all of you belong to us, and it's our responsibility to make sure that you all reach your dream destination. So I humbly request, okay, it's not something of a rule, but I would definitely feel that you can play your part in order to support the other student to reach their dream destination as well. Not just you reaching your dream destination, you can do that nobility. All right. So I would definitely request all of you to share the very same link on your social media platform, because when you share, a lot of your colleagues would feel that yes, you wouldn't share something which is not important, isn't it? Because there are certain students who are still finding it trouble to manage time and all. So if you think that this is going to be valuable, please do share. Yeah. Lisamol done, Sonia done, Sobi done, Lisamol, Bijishree done. Then Josna John saying C from third line. Okay, fair enough. Anujo been done. Excellent. Now I would ask you to comment on what are your answers and where you got that answer from. That where is very important. Okay. See, not just what is your answer, that where you got that answer. Because as a trainer, it's our job to correct from where you went wrong. Understand? Like what Josna John said, C from the third line. Fair enough. I'm not saying that is right. I'm not saying that is wrong. It is up to you to say, Christina done. Kalai, C from middle. Okay, fair enough. Now see, I have got the first few answers, which is C. Okay, which is saying they have got it from the third line or from the middle. Now, I want all of you to comment. Please do not hesitate. See, on the New Year day, isn't it? Now you have to start telling yourself, see, I am here with a purpose. My purpose is I'm going to comment what is the answer that I've got. Whether it is right or wrong, doesn't matter. I have got this. I'm here to make it to my dream country. What is my dream country? Come what may, or be what it is. Let it be Australia, let it be New Zealand, let it be Ireland, let it be UK, let it be Scotland, let it be Canada. You name, or let it be your so-called America. Doesn't matter. You are here with a purpose. So Sonia D'Souza is saying C from middle of the para. Fair enough. Monica, C from the gist of the para. Okay. Bijishree, C from middle. Christina Wagi, C. So unanimous answer is coming as C. Is it? See, that's where you have to start telling what is my purpose of attending. This is another big time move in order to complete, all not before time. You have to do that. See, that comfort zone, coming out of that comfort zone is very, very, very important. Sarah, C from the whole para. Christina Wagi, C. Lisamol, C. Okay, C. So all of you are saying C. Anu Jobin, C from the whole para. Okay, fair enough. Bettina, C from the fifth line. Okay, fair enough, exactly. That's how you should be telling. So if you have any doubts with regards to what Neethus Academy can be of benefit to you, there's a number on the screen. Please do not hesitate to contact them. They will be happy to assist you. And just a few quick, if you think that you need a professional approach, you're always welcome to join us. The next batch, which we are going to close soon, where it is only from Feb, March and April. We have regular batches and we have crash courses available. You need any info, please do not hesitate to contact the number on the screen. Reni Chaco, C. Alright, now you have all given me an answer. Now let's see how to deal with part B. Part B, you're going to read the question first. Okay, please read the question. And as you read the question, you're going to underline the key words in the question. Please understand, parts B is about how you relate it with the question. So first and the foremost important thing is reading the question, underlining the keywords in the question. Now let's see, in the prospectus for infection prevention, okay, what are, now see, control professionals required to do? So in order to prevent, control professionals required. So what did I understand from the question? You are asked to find what control professionals need to do, not anybody else, the people who are controlling the prevention of infection. What are them to do? Understood? Confusing with A and C, but going with C only. Okay, fair enough. Let's say, so we're saying confusing with A and C, so decided C. Now, Neethu George is saying, so I have the first answer. Neethu George is saying I have the answer B. Fair enough. Okay, now I have B and C. Now, prepare an exhaustive analysis and control an outbreak. So, prepare analysis, not only just prepare analysis, but also to control as well. So, prepare, analysis, control. That's enough for me. Okay, I have not. Now, option B, what are control professionals required to do? They are going to prepare a chart a course to apply policies to cut an infection. That cuts an infection. So chart a course, prepare analysis and control. Implement practices that are best suited for individuals. Okay, that means a customized plan. Now, let's read the paragraph. Okay, I forgot to mention, as I always say, there are two ways. First, you have to do the three things. Read the question, underline the keywords in the question, understand the question. After that, you can read the paragraph and then pick an answer. Or if you're like me, because I always follow, I need to know what I'm searching for in the paragraph, so I read my answer options, underline the keywords in the answer option, and then I pick it up from the paragraph. Okay. Now, don't skip anything. Infection prevention and control professional. So this is definitely infection prevention versus control professional. A person whose primary training is in either nursing, medical technology, microbiology, epidemiology, and who has acquired specialized training in infection control. So these are all about the control professions who are to do. Now, what are they to do? Now see, responsibilities may include collection, analysis, feedback of infection data, claims to healthcare providers, that is one. Then, consultation on infection risk assessment, prevention, control strategies, second responsibility. Performance of education training activities, third responsibility. See, these are all columns given, isn't it? Semicolon. Implementation, evidence-based infection control practices and those mandated by regulatory licensing agencies. Next responsibility. Application of epidemiological principles to improve patient outcome. Next responsibility. Participation in planning, renovation, construction projects to ensure appropriate containment and construction dust. Next responsibility. Not only that, evaluation of new products or procedures on patient outcome. Next responsibility. Oversight of employee health services related to infection prevention. Next. Implementation of preparedness plans, communication within the healthcare settings, with local, state health departments, with the community at large concerning infection control issues, and participation in research. So these are all the responsibilities of who should do? The control professionals should do. Now see, they have given you n number of things, isn't it? So is it just, see, there are a few words that you have to really look for. One, exhaustive. Okay, now exhaustive. Now what are they saying? It's an adjective. It's including or considering all elements or aspects. So there are a lot of factors that needs to be looked into. That's why it's called exhaustive analysis. Okay, so for me, slightly pointing into A. Okay, now the next word, there's another word which is called preparedness. Okay, so what is preparedness? It's a noun which says a state of readiness. That means you're ready to plan. Okay, now let's see. Okay, as I mentioned, because there are a lot of things which are saying, so prepare an exhaustive analysis, not only analysis and also how to control an outbreak. All these things are talking about that only for me. Now let's see why B is not the answer. Chart a course to apply policies that cut an infection Is that only saying how to prevent an infection? No, they are giving a lot of things, isn't it? Not only that they have to oversee health services related, not only they have to communicate, there are lots of things. So not just about infection. So this is a straight eliminator. Now for the most preferred answer. See, implement practices, okay? There are a lot of practices mentioned, yes, that are best suited. This is a problem. Where is it saying it's a customized plan according to the patient? Now this is where your part B is going to trick you. 95%, I'm just going to change the color so that you know. See, 95% is there. Implement practices, yes. Prepare and exhaustive. This is not only preparing. Implement is the next problem. Implement means you have to put it into action. And there's a problem there. So 95% is not there. So implement for individuals, not mentioned. Understood? So they are saying these are who they are responsibilities. That means prepare an exhaustive analysis and control outbreak. These are the things, all these things are talking about. Implement practices which are best suited for individuals is not the answer. So the answer to the question is congratulations on the New Year's Eve. Nobody got it right. But let's keep it as a learning curve. There are n number of things for us to improve. And we are here to improve. Understood how the answer came? Easiest was elimination. For me, the first and the foremost, when I read that, it was for individuals, because they are not saying about individuals anywhere. It's individuals means you have to customize it. Nowhere it is mentioned. But what you have done, you have comprehended. You're saying, okay, maybe. See, part B, I have always told you the answer should be there in the given paragraph. Clear? Monica Vegas understood. Lisa Mole, don't be sad and all. We are here to uplift you. That's why I told you regular attendee and regular participation is of utmost importance. Anuj Oben understood. Sarah, do not cry. You're not supposed to cry on New Year's Eve. We are here to help you. We will lift you from where you are to your dream country. But of course, that's what I told you. Not only that, that reading habit is going to enhance all these. Your part B, part C, everything is going to be a piece of cake for you. Ashley clear, Lisa Mole, yes, Revati Balakrishnan, good afternoon. Josna clear, Sonia clear, Neethu understood, Kale, because of exhausting word I eliminate. See, don't just eliminate on the aspect of just a word, yeah? That's where we go wrong. See? Words are always deceptive. You have to link along with the word reference synonyms is for part A, not for part B. It's about understanding the gist. Fair enough, but I like the way that you have taken it lightly. See, you have to take it lightly because we are here to learn. All right. So happy that all of you understood. All right. Any doubts with regards to what I've told you? No. Fair enough. So shall we all move into the one that I missed, isn't it? Very unfortunate. I was talking about it, and suddenly the whole sound went off. Bazoom. Yeah, bizarre. But it does happen. Kalai, thank you. Pleasure as always. All right. So shall we go to the same part A material? And I was, in a way, I was a bit happy on the aspect because that day it was not the way that you wanted us to come, isn't it? Because I had to come from a different way. So you never wanted it that way. You wanted the AV to come in front of you, isn't it? So it's always, we take it as blessing in disguise. Rachna Rupesh Patil, good afternoon, a very good afternoon. New name, is there anybody who's attending the live for the very first time in front of me? Angana, I don't know who's attending the live for the first time. If so, please do let me know that you are here for the first time and where you are from. Anybody like that? Anybody attending the first time? No? All right. Bettina understood. Fair enough. Now, I don't think that there is any, but I found few new names. Yeah, that's the reason I asked. But again, if you're not, no problem. As long as you're there attending on a regular basis, sharing the same link, liking our page, subscribing, showing all the support that you could for us as a family, no problem at all. Sujita VS from Singapore. Okay, Sujita, very nice to meet you, because after some time I have a student from Singapore, because the previous student have all reached their dream country. So Sujita from Singapore. Christina Rose, first time. Christina, would you be kind enough to tell me where you're from? Because I love to say to myself, I know people. Now I can say I have another person from Singapore. So when I come to Singapore, I have known people as well. Good enough. Princy Binu, good afternoon. Rachna Rupesh, me first time. Kamala Veni, first time. Vinita Majish, first time. My happy. New Year, what else could we ask for, isn't it? A lot of new people. Absolutely good enough. Christina from Ernakulam. Thank you very much, Christina. So I have Sujita from Singapore, Christina from Ernakulam. Then I have who? Right, Revati, Happy New Year. Fair enough. Kamala, Veni, Vinita, all from first time. Okay, fair enough. If you could tell me where you're from, would be highly appreciated. If not, also no problem. Yeah. Tina Joy, first time. So thank you so much. Lot of new people. Princey Binu, Happy New Year. Happy New Year, Princey. Rachna Rupesh, I'm from UK. Absolutely stunning. I know that it is so cold there. It's so nice that you're there coming, and most of our students, dream country, you're all there. So you are one lucky person, Rachna. Good enough. Tina Joy from Iduki. All right. So see the diversity of the classroom that you're attending, isn't it? You're attending an absolutely international classroom. Divikuti, Happy New Year. Happy New Year, Divikuti. So we have people from Ernakulam, Iduki, we have people from UK, we have people from Singapore, Qatar. What else could you ask for? So yes, thank you so much for enlightening our new year with your presence. Right, now let's go back to part A. The material will be popping up on the screen. Now with the help of AB, I'm just going to talk to you. Have you all done the material? Are you all ready with your pencils to put tick, 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 tick? Yes? I know that I've already asked you how the material was, and the general outline was easy material, isn't it? Now, just to show you why skimming and scanning is the most appropriate methodology. So scanning, you're going to have a detailed look. Skimming, you're going to have a quick look. That's the difference. Now, why skimming is important? How much time? 1 to 2 minutes. But I always tell my students, you should come up in order to bring that 8 minutes into contention. You have to skim the text in 15 seconds of time. 𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿𝐿. Hi sir, good morning. Happy New Year. Happy New Year, 𝐿𝐿𝐿𝐿𝐿𝐿. Recently I missed your classes due to some issue. Today onwards, I'm a regular student till your exam. Am I obliged, 𝐿𝐿𝐿𝐿? I am going to be your regular trainer till you take your exam. All right? Very kind enough. So happy to see all those lovely words from your side. Thank you very much, 𝐿𝐿𝐿, for that support that you're rendering towards Neethus family. Monica, yes. Okay, fair enough. Now, what are the next thing that you have to do? So when you get a material, okay, this is what you're going to do. So what are you going to do? You're going to underline the keywords. I'm going to talk about these keywords and all in the ensuing classes, okay? So do attend on a regular basis so that you do not miss in order to reach that 8 minutes, okay? Always tell yourself 8 minutes is my time. Now, what are you to do? So quickly go through. Don't read word by word, okay? Quickly go through it and underline the keyword. I'm just going to show you very quickly. If you want, you can keep a timer. See how quickly you're going to underline the keyword. So transmyocardial TMR MLR is a procedure to improve the flow of your oxygen-rich blood in your heart muscle. It reduces the angina, chest pain, and symptoms of coronary artery disease. The heart needs it. It also survives the coronary artery deliver. Coronary arteries is clogged and coronary resulting in the decreased blood flow, lack of oxygen-rich blood in the ischemia, increase in the angina and heart attack. People who are coronary is treated with medical angioplasty technique. Coronary bypass and the enhancing of the blood flow and so remain symptomatic. Angina is conventional therapy is exhausted. TMR is often the safest and the most effective appropriate for that people. Done. Did that take 15 seconds? Did you? Do you keep a timer? I'm sure I have done it in less than that. So this is called skimming. In order to do that, you have to have a regular practice, and also on top of it, you should understand. It's not just going through it. As you skim, you should be differentiating it. Okay. Now I have done text A. Likewise, you're going to go to each text. Okay. Text B, machine monitoring. Likewise. Okay. Now they are talking about a lot of methodologies, intravenous line tranquilizers, comfortable speed, surgeon makes an incision. Now I know that, okay, something about it. Now what is text C talking about? Text C is talking about indications, not only indications, contraindications as well. So text C is about this. So anything with related to indication and contraindication, go to C. Now D, of course, is a study. So anything with regards to a study question, go to D. This is how you should differentiate your 4 texts. Ilakia Raman, hi. After this, you're going to go to the question. There are 3 types of question out of the 20. So you should be aware of it. 1 to 7, these type of questions are called match the following questions. So types of question numbers and the instruction should be by hearted again to come up with that 8. Understood how everything is related? Whatever that we teach, we have a clear-cut agenda on here. Okay, our focus is to make sure that you reach this 8. So this year's New Year resolution is to make all of you make that 8-minute barrier. Alright? Now, for each of the question, instruction should be by hearted. You may write any of these letters, A, B, C, D, and you may use any of these letters more than once. A very straight instruction. Okay? Now see, why it is important that your keywords. Okay, now see, what can be given to patients to relieve before surgery? So where are they talking about all these procedures? I'm saying because after I just went through, it is in B. Why? Because they are talking about a lot of procedures, isn't it? Electrocardiogram, machine monitors on this thing. So before, a mild tranquilizer is administered to help you relax before entering the operating room. We don't need that exact sentence, but this is how you refer. 𝐻𝐶 Samuel, hi. Understood why keyword reference? Again, always ensure that this is your focus, 8 minutes. We don't need to really worry about certain questions. You can even refer without even going to the question. Now see the next one. Candidates who are not eligible for transmyocardial laser revascularization. Not eligible. So it should be under contraindication. Isn't it? Where is contraindication and indication? See, 𝐻𝐶 Samuel, Happy New Year, Happy New Year. So where are they saying about all these? These are the people who have all these, sorry, not that, this one. Uncooperative patient, critically ill elderly, dementia, all those things. Do you really need to worry about it? Not necessary. Understood keyword referencing? Please don't comprehend answers. Just refer with the keyword. Now let's see, next question. How many people opted for medical treatment instead of TMR? Do you need a second thought? It's about a study, isn't it? Many people opted for medical treatment. So if you really want, medical treatment is here only. How many opted? Do you need to know the number? Not necessary. D. Understood keyword referencing? Good. Complications can arise due to insufficient oxygenated blood flow in an individual. So they're asking you about a complication. Where is this complication mentioned? Insufficient blood, this thing. A lack of oxygen-rich blood flow may lead to ischemia, angina, heart attack. So the answer is A. Understood? Now the mortality rate in people during follow-up undergone TMR. Do you need a second thought? Not needed. Why? Because he died, TMR. Okay, this is what it is. That is it. Understood? Good enough. Optimal alternative approach for those patients, traditional therapy. So alternative. So that means instead of, something to replace, substitutive. So where are they talking about substitutive methods? So where they're again saying TMR is the most and safest, most effective treatment for such people. So there are certain things which is happening. So what is the alternative? TMR. So the answer is A. Maximum duration required for the completion of procedure. So where do you think? I am saying B. Now let's see whether it is there in B. The entire thing finishes in 2 hours. Understood how you refer? These are all your 8 minutes clue. The next set of questions. These set of questions are called short answer question, where the question number starts from 8 to 14. Should be by hearted by you. Okay. Now instruction. What does the instruction say? The instruction says the answer can be a word, number, or both. That means word and a number, or a short phrase. See, with the present thing, the answer can be up to 2 to 3 words. Okay, on the day of exam, you'll get an answer which is anything hovering about 2 to 3 words. Please always stick to it. Now, strategy doesn't change. Underlining keywords and referring keywords. For how many months have the 67 patient underlined? So now it is time to scan because you have referred with the keyword. Now where do you know? You know it is how many months, isn't it? Now, how many months TMR is here? How many months follow-up is there? 67 patient also there. So what is the answer? 12, not month, okay? 12 should be the answer. Clear? So number 12, okay? 1, 2 is the answer. Now, which management approach in the study group have resulted in large number of fatalities? So management approach. So where are they talking about? There are 2 management approach. Why? TMR, medical treatment. Now that is not just the question. Fatality, that means who have lost life more. Is it TMR? TMR has 13 deaths. Medical treatment has 7 plus 15, 22. So definitely the answer is a 2-word answer. Medical treatment. MEDICALTREATMENT. Clear? Now, for patients who are medically unstable, what may be required before the procedure? So maybe, what are they talking about? It's going to be there in C. Why? They are saying, see, what may be required. Anywhere it is mentioned? It is clearly mentioned, medically unstable patient may require anesthetic support. ANAESTHETICSUPPORT. Clear? Excellent. Now, how does inserting a tube through nose and throat into stomach prevent the buildup of which substance? So they are saying inserting a tube, all those things. So which substances? Now see, this is the next clue for that thing. Substances, singular or plural? Definitely plural. So that means more than one. So now go and see. Where are they saying? Again, it should be somewhere in B. So another tube inserted, nose, throat, stomach, all those things. So what are those? Liquid and air. So LIQUIDANDAIR is the answer. eGFR less than 30 ml per minute per 1.73 M2 signifies. So eGFR I have only seen in C. Why? Here, eGFR 30 ml, all those things. So what is that? Impaired renal function. IMPAIREDRENALFUNCTION. 3-word answer. Excellent. Now for question number 13. How wide? Okay, so there should be, the width is what? The question is 20 to 40 channels created by carbon dioxide laser procedure. So where are they talking about all these carbon dioxide laser procedure? B, isn't it? So 20 to 30, yes. How wide? 1 mm. 1 mm. Good enough. What condition? So definitely a state. Blocked arteries causing blood flow to cardiac muscles. So where are they talking about all these things? So what is the condition? The answer is coronary artery disease. That is therein. So coronary artery disease causes clogged clone, blah, blah, blah. All those are straight answers. So 3-word answer. Coronary, CORONARY, ARTERYDISEASE. A 3-word answer. Now for the final set of questions, these set of questions are called fill in the blanks questions, where the instructions remain same as short answer questions. But here, you should be cautious with your articles and redundancy. If the word is given in the question, you are not supposed to write it. Okay? So please always ensure that you refer with it. Despite receiving, so instead, not only, okay, or even after receiving, that certain patient may continue to experience symptoms like angina and prompting the consideration of TMR. So what are they talking about? So they are saying despite having, so some may remain symptomatic such as angina even after conventional therapy. So it's a 2-word answer. CONVENTIONALTHERAPIES is the answer. So individuals with DASH compromised mobility, so that means they are not able to walk properly, restricted life expectancy and advised undergoing TMR. So definitely it should be there in C somewhere, isn't it? Contraindication. So they are saying, which one are they saying? So impaired mobility, limited life expectancy. So what is the answer? Dementia. DEMENTIA is the answer. Excellent. Question number 17. Insufficient, so that means lack of oxygen rich blood supply to the heart causes elevating angina and heart attack. A, isn't it? Those are the 2 words, angina, heart attack. So a lack of oxygen rich blood into the heart leads to ischemia. ISCHEMIA. Question 18. Once you are asleep, a tube is inserted around the trachea, connected to the respirator to facilitate. Why is that connected? So definitely during procedure, isn't it? So where are they talking? Completely asleep, tube is round trachea, connected to the respirator, which will allow breathing. BREATHING. Question 19. A specialized dash is employed to create 20 to 40 minuscule channels in heart muscle to ensure optimal blood flow. Again, something to do with B. So 20 to 30, 1 minute wide to complete. What is the answer? It's a carbon dioxide laser. CARBONDIOXIDELASER. That's a 3-word answer. The ultimate question for today on the New Year's Day. Out of the dash individual, the study cohort goes straight to D. 101 received medical intervention. Out of the 192 individuals, 101. So 192 is a number which is there. So I have fired my 20 answers. Please be kind enough to tell me. If you have any doubts, please do clarify. If not, shoot your total scores. Really looking forward to see how much you have got on your day on New Year. Even though your response of typing answers was a bit slow, but I would say I'll take it. Why? Okay, a bit confused on the aspect certain things. Any doubts with regards to any of those questions? Anything that you want me to clarify? Please be kind enough to ask. Or if not, do shoot your total scores. What are your total scores? Tell me. Excellent. Monica Vega is 18. Excellent. Revati Balakrishnan for 18. Okay, excellent. Good enough. Good enough. How about others? Do tell me your scores. Yeah, do not worry about it. Or if you have any doubts, please do clarify. Is there any doubts that you have? You want me to clarify? No doubts? All right. Because all of you have no doubts. So once again, a very happy new year to all of you. All right, as I've mentioned, this year, our gift to you, the new year gift, is how to tackle part A in 8 minutes. So I've told you three things. 1, attend regularly. 2, what did I tell you? What did I tell you? 2, start reading as a habit. 3, focus. These are the 3 things for today. I'll be talking the balance tomorrow and the continuing classes to reach 8 minutes of time. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Stay blessed. Bye.